when you have a maternal death, it is really crucifying a whole family, a whole community, and a whole nation. And therefore, government has made it a national emergency to tackle maternal health and neonatal health. MDGs 4, reducing child mortality, and MDG 5, improving maternal health, are really two key challenges to us in the health sector.
The need and desire to access health information is universal. Imagine a pregnant woman experiencing pains, or a parent with a child who has a high fever. In developed countries, information is often readily available through the internet, and expert advice is a phone call or a short car ride away. For poor individuals in less developed countries, the situation is quite different, such as here in the Upper East region of Ghana. In rural areas such as this, health facilities are the only source of reliable expert advice. Local myths are prevalent, some of which can be damaging to mothers and children during pregnancy.
The myth here is that when you just start labor and you come to the health facility early, it means that you are a coward and you fear pain, so they don't come early. By the time they get to the health facility, it might be too late.
Transport is scarce and unaffordable in these areas. Road networks are poor, so health facilities may be a long walk from home through the baking heat. Basic services may be scarce here, but the simple mobile phone is increasing in abundance. Mobile phone ownership is growing rapidly in even the most remote communities. The Mobile Technology for Community Health project, known as MOTEC, is aiming to create a world in which these mobile phones enable poor individuals to access health information that is reliable, affordable, and relevant to their lives. By designing technology solutions together with users and communities, MOTEC has been able to ensure that its services are accessible, easy to use, and tailored to client-specific needs. MOTEC has created a service called Mobile Midwife. The service sends people information on their mobile phones. Content for Mobile Midwife was based on pregnancy and child health materials from Baby Center, an online parenting resource. This was then localized for the Ghanaian context by MOTEC.
When a client registers with MOTEC, he or she gives us the date of birth of their child or the date of expected delivery of the pregnancy. With this information at hand, MOTEC will regularly give them information that is specific to the age of the child or the age of the pregnancy. Illiteracy is a challenge in our community, so clients can choose to receive their messages in audio recordings in local languages or as SMS.
Ayana memeji bula o nom kokroso akoto na tansi de bemba je jawer balu iran toto ayana boase na joko koto kwenku wa ko dambu ba yewe ko atansi de kudona wa ko damba bemba ba wel ba wuta ba bre ba wodi ta lu ba anja for hospitals ba nestina ba to ba wel.
1 week before an antenatal appointment, MOTEC sends a message to the patient to remind them to go to the health facility. If a patient misses the appointment, they receive an alert to urge them to go to the health facility soon. Meanwhile, similar information is provided to the nurses. Every Monday morning, they receive text messages listing patients who are overdue for certain care. By reminding both nurse and patient about the appointment, MOTEC aims to increase the quality of healthcare provided. MOTEC is currently being piloted in one district in the Upper East region of Ghana. A rigorous social impact assessment will measure the effect of the program on health outcomes. We believe that as MOTEC continues to empower women, healthcare workers and communities with critical health information, over time, it will demonstrate its great potential for improving the health of mothers and babies, not only in Ghana, but all around the world.